All right, so what's the name of this joint? Yes, it's between what two bones? The tibia and the talus. So it's called the tibiotalar joint, right? Or tibiotalar joint. It's also called ankle mortise joint. I don't think that's taught in DA anymore, but it's called the ankle mortise joint, just so you guys know, okay? So tibiotalar joint. Now, we're gonna practice a few moves with the tibiotalar joint. We're gonna do LAD, A to P, P to A glide, medial to lateral, lateral to medial glide, okay? Kyle, can I borrow you on this table? Can you actually lie with your head on that side so everyone can see the movement? Oh no, this is right. All right, so last trimester, if you remember, Dr. Richards taught you to run your hands over the tibia until it stops, right? And you're most likely on what bone at that point? The talus, okay? So it doesn't matter which hand goes down first. You're gonna contact the talus, you're gonna double enforce with your other hand. So I'm using my chiropractic index finger here, double enforcing. With your thumbs, you're gonna dorsiflex the patient's foot. I'm sitting at the foot of the table, my elbows are tucked in. I'm gonna lean, inferior, joint play. Lean, joint play. You always compare side to side, okay? So that is long axis distraction of what? Tibiotalar joint, right? Or tibiotalar joint. All right, so next we're gonna do A to P glide of the tibiotalar joint. So what you're gonna do is you're gonna stand here. With your thumb pads, you're gonna contact over the joint. So we're really contacting the talus, okay? With my finger pads this time, I'm trying to dorsiflex as I push with my thumbs. All I'm doing is pushing down towards the table, joint playing. Pushing down, joint playing. I'm trying to increase the surface area, so instead of double enforcing my thumbs, I'm actually putting them next to each other and pushing the bone back, okay? So just like this, push, joint play. Now for P to A glide, it really doesn't have a good contact because it's almost impossible to go through the Achilles tendon, all the fascia in the back to get to the posterior part of the talus, okay? So what we do is you contact and stabilize the tibia, you cup the heel, and you pull it up towards the ceiling. If you want to be more direct, you can try to get your thumb and your index finger closer to the talus on the posterior end, okay? So stabilize the tibia, pull the heel up towards the ceiling. That palpation is not really done a whole lot. We really do A to P a whole lot, okay? All right, next two movements. This one, for whatever reason, gets a lot of people confused. Medial to lateral, lateral to medial glide of the tibiotalar joint. If I'm trying to induce medial to lateral glide of the talus, what I do is use my outside hand, specifically my chiropractic index finger. I'm gonna put my contact over the talus and pull it out medial to lateral, okay? Now I'm gonna double enforce and do the motion with both hands. So from here, I'm gonna double enforce. This hand is the one mainly doing the job, this hand is just helping, okay? I'm gonna pull the talus, medial to lateral, joint play. Am I inducing inversion or eversion? Inversion. Inversion, okay? But a lot of people think of medial to lateral as eversion, or think of inversion as lateral to medial. So think about pulling the talus. So contact, double enforce, dorsiflex them, pull, joint play. Okay, that's medial to lateral. Now if I want to do lateral to medial, I'm going to use my inside hand. Contact the talus, double enforce this way, this time pull this way, joint play, right? So the hand that's at the bottom, that's the one really palpating, the other one is just helping double enforcing to create more motion, okay? Medial to lateral, use your outside hand. Lateral to medial, use your inside hand. Medial to lateral, you're inducing inversion. Lateral to medial, you're inducing eversion. Good? Easy? All right, part